Thank you very much for the opportunity to testify. I want to thank both Chair DeLauro and Ranking Member Cole for your support of heart valve research and medical research generally. Both of you have such an incredible track record of advocacy for the National Institutes of Health, and I appreciate your willingness to listen to my efforts to honor the legacy of my late wife through the Carroll Act. As you may know, on June 16th of last year, I tragically lost my wife, Carol, to sudden cardiac arrest. She was only 39 years old, just a few weeks away from her 40th birthday, and just a few days off from our 12th anniversary. She was the best wife, mother, daughter, and friend anyone could ever have. The medical examiner and Carol's doctors told us that her fatal heart attack was likely brought on by a ventricular arrhythmia. At a young age, Carol had been diagnosed with an underlying condition called mitral valve prolapse. We knew about this. It's also called floppy valve syndrome. It's typically a benign condition that results in sudden cardiac death only in 0.2% of the cases. Certainly, we had no idea that her life was in jeopardy. Her doctors didn't even know that her life was in jeopardy. She didn't know. The American Heart Association reports that isolated MVP and sudden cardiac death predominantly affects young females with redundant bileaflet prolapse, with cardiac arrest usually occurring as a result of ventricular arrhythmias, which is when the ventricle just doesn't pump. According to the National Heart, Lung, and Blood Institute, heart valve disease occurs if one or more of your heart valves do not work well. Many people in the United States have heart valve defects or disease but do not have symptoms. For some, the condition remains the same throughout their lives and does not cause significant or life-threatening problems. Unfortunately, over 25,000 people die each year in the United States from heart valve disease, primarily due to underdiagnosis and undertreatment of the condition. Specifically, Carol's condition, mitral valve prolapse, is a common valve disease that has an estimated 2.4% prevalence. Though most cases are thought to be benign, reported complications such as severe mitral regurgitation can result in sudden cardiac death. Medical research has found an association between MVP and sudden cardiac death. Predictors of this outcome, however, are not readily available, just as they weren't in our case. Underlying mechanisms are poorly understood, and indicators of high-risk individuals are lacking. Despite several studies, there is not sufficient data to generate prescriptive guidelines for care of patients with valvular heart disease, including MVP. We were always told, Carol was always told, this is not a big deal. We just have to monitor it. Well, we were monitoring it. She did go to the cardiologist, and there was no way for the doctor to predict this catastrophic event. That's why, inspired by the extraordinary life of Carol, I introduced the Cardiovascular Advances in Research and Opportunities Legacy Act, or the Carroll Act. This legislation will address the gaps in understanding about what risk factors make valvular heart disease a potentially deadly condition. More specifically, the bill will authorize $20 million for 5 years to establish a grant program administered by the NHLBI to support research on valvular heart disease, including MVP. This research will advance technological imaging and precision medicine to generate data on individuals with valvular disease and develop prediction models for high-risk patients, enabling interventions and treatment plans to keep these patients healthy throughout their lives. And surgical intervention works in these cases. We didn't know we needed the surgical intervention. That's the problem here. Additionally, legislation will convene a working group of subject matter experts to identify research needs and opportunities to develop prescriptive guidelines for treatment of patients with mitral valve prolapse. It will also instruct the Centers for Disease Control to increase public awareness regarding symptoms of valvular heart disease and effective strategies for preventing sudden cardiac death. The Carroll Act has garnered the bipartisan support of over 140 of our colleagues, and companion legislation was introduced in the Senate by Minority Leader Mitch McConnell and Kirsten Sinema, our former colleague here in the House. Additionally, it has the support of over 20 medical groups, including the American Heart Association, the American College of Cardiologists, and Women Heart. To further advance our efforts, 16 of my colleagues joined me in a letter to request $20 million in the FY22 Labor Appropriations Bill to be directed to the NHLBI to address the gaps in understanding about what risk factors make valvular heart disease a potentially deadly condition, and be specifically administered to accomplish many of the same research initiatives as in the CAROL Act. In drafting this appropriations request, we worked specifically and very closely with Dr. Gary Gibbons. I spoke with him personally about this and his team at the NHLBI to ensure our efforts would properly respond to their needs as they requested to complete this work. Though there is some ongoing research at the NHLBI on valvular heart disease and specifically MVP, the $20 million figure goes to the expansiveness of the research needed to examine the risk factors associated with valvular heart disease and sudden cardiac death and develop these prediction models and guidelines for high-risk patients. Through this research, I truly believe we can save lives, we will save lives, and help families avoid the tragedy that has profoundly affected mine and my girls, Eleanor, age 10 now, and Mary Clay, age 8. Again, I thank you so much for your time and for your support. This is a worthy cause. It's obviously very, very personal to me, but I can tell you that in talking to scores of cardiologists in the last 11 months, they need better tools and guidelines to help predict this because they can save lives if they just know who is at high risk, and they certainly did not know Carol was. So I appreciate your consideration, and I yield back.